Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations. Globe Care Hospital in Eastleigh, we delivered and installed an X-ray machine. Lydia Key Memorial Hospital, we delivered and installed an X-ray machine and a computed radiography machine. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly,
welcome to Medicwise TV. This evening, Monday evening, we are privileged to have a special guest on set. In Medicwise TV, we promise and we deliver. This is the haven of healthcare conversations, and today we are privileged to have a very special guest with us, Madam Nelly Ronoh. Madam Nelly Ronoh is a distinguished educationist, an entrepreneur, and has passion in ultrasound. So as we advance our conversations towards the upcoming Radiographers AGM, and I understand she is one of the presenters, facilitators in the AGM coming up this weekend. So we don't take it for granted to have her in our studios today to have this passionate discussion about healthcare, and more particularly radiology and imaging in the region and within the country. So welcome our viewers. We don't take it for granted. Remember, we have our WhatsApp number on your screen. If you want to interact or send suggestions or recommendations, or you want to ask questions directly to Madam Nelly, please do it through the WhatsApp number. So Madam Nelly, very most welcome to this interview. Sorry, I'm trying to have difficulty in pronouncing your name. But that is very, very normal.
Yeah, it's understandable.
So welcome to our studios. We are happy to have you this afternoon.
Yeah.
And we appreciate for taking time to be here.
Thank you.
So you can take this opportunity to introduce yourself to our audience.
Okay.
Many people may not be knowing who is Nelly, what's your background, what do you do, and what is your passion.
Okay.
Welcome.
Asante. So good evening, everyone. My name is Nelly Ronoh. I come from Bomet County 036, which I'm very proud of. And besides that, I'm a mother of 3. I have a son who is 19 years, a daughter who is 14, and another daughter who is 12. And beyond that, I would say I'm an all-rounded diagnostic imaging specialist because I have done different courses. But what I'm known for is mostly I would be recognized as a radiographer, specialized in ultrasound, and that is where my passion lies. And I want to also say that it is my calling. I say that is where my purpose is, because each time I do ultrasound, I feel fulfilled doing it. So thank you.
I understand, Nelly, you are, other than being a radiographer, you have pursued other levels of education.
Yeah.
Neurophysiology being one of them. Maybe
Yeah.
members would want to know
Yeah.
more
My-
about your education background,
Yeah.
so you can clarify.
Okay, so my educational journey has been quite a journey and a very long journey. I started off with Neurophysiology Technology from 2008 to 2011 when I graduated, and soon after I was in the second cohort. It is actually a course that no longer exists at KMTC. It was scrapped off at some point because of challenges in facilitation, lecturers and all that, which I feel and I strongly feel that should be brought back. And after 2008, I went back home, being a mother and everything else. I couldn't find a job in neurophysiology. So I requested our then HOD, Mr. Nyala, may his soul rest in peace. He really facilitated those of us who wanted to transition from neurophysiology to MIS. And in 2012, I came back, and the college was kind enough and gracious enough to enroll us in second year. And I did my my diploma in MIS from 2012 to 2014. I graduated, and immediately after, before even my graduation, I enrolled for a higher diploma in ultrasound from 2014 to 2015. And after that, I got admission to JQuat as well. And I remember one of our seniors, Anthony Mamati, I had to go and consult him, and he told me that unfortunately I couldn't enroll for a degree without doing the MIS. I couldn't do a degree.
Okay.
So I did, I had to start through the help of our
Diploma,
seniors.
yes.
So I remember that time I had a small baby and I was in tears, and I just decided if there is no other chance, then I just have to go back the way he advised. So thereafter, I enrolled at JQuat from 2016. I graduated in 2020. That was like 4 years. We lost like 2 semesters to the lecturer strike. And somewhere even along the way, I got a supplementary. I had to redo and all that. And that's why I had to graduate in 2020. Then in 2021, I enrolled for a master's degree at University of Nairobi in Health Economics and Policy. And I'm still pursuing it. I paused it for a while. Okay. And last year, in 2025, March, I enrolled for my master's in ultrasound, which I'm done with my first year now. I'm now at 2.1. But the most tasking part in terms of the ultrasound bit is done. We are only left with next semester, which will be doing echo. So that has been my educational journey.
Where are you doing your ultrasound master's from? Which college? Just the other day we were talking with other members here, and they felt there are no opportunities to study further studies, but we understand you are doing a master's in ultrasound.
Yes.
Maybe members will wish to know from which institution. Are you doing it online?
No, it's not an online. I would say it's a blended course, because all the theory classes are actually online. But as we know, ultrasound cannot be a theory course. It is a
Hands-on,
practical,
yeah.
yes, it's a practical course. So we usually do online on the e-learning platform, and that is whether you're in Uganda, you're in Kenya, all the theory classes are done on the e-learning platform. But then the practicals, you have to attend them physically. They can be structured, but usually there is a structure there. And for international students, usually the most recommended would be to have a cohort whereby you can plan when to go for your practicals.
Okay.
Yeah.
So you are doing it in the region?
Yes, I'm doing it from Uganda.
Specifically in Uganda?
Yes.
Okay, that's very good.
From Cook University.
So, understandably, you have a heavy educational background, and you practice sonography.
Yes.
So what is your passion in sonography? Maybe people will want to know what is your passion in sonography. Just the other day we had Mr. Ian Kembo here, and he was saying he has passion in fetal ultrasonography.
Yes.
So in your case, do you have any bias, or you are just a general in ultrasound?
So I actually practice general ultrasound on a day-to-day basis because I have the adequate skill set for everything. But then where I have a lot of interest is in MSK, that is musculoskeletal ultrasound, and in vascular ultrasound. That is where I would want to, mentor and be able to teach others.
Talking about musculoskeletal ultrasound, where you have your bias, I understand on Thursday we have a pre-AGM workshop.
Yes, on Friday.
In which you are one of the facilitators.
Yes.
So maybe you can take this opportunity to brief members. What do they expect or coming Thursday?
Okay. So during the pre-conference, the pre-AGM workshop, we will be doing MSK across all modalities. We will have Dr. Onyambu, who is a MSK radiologist. Yes, she's a radiologist. And then we will have myself. I'll be doing the wrist, real actual scanning, the protocol.
Yes.
And we will have Richard Ademayon, who will be doing the shoulder. We will also have Dennis Odhiambo, who will be one of our facilitators as well. And we also have one of the guests from Uganda who has been our clinical instructor. He's called Mr. Umara Mutesasira. He will be taking us through the knee and other tips and tips of doing ultrasound. So we really have a very rich team, and we would encourage that our members to attend.
So members, you can hear there will be rich facilitators on Friday on the pre-AGM workshop, where Madam Nelly is one of them, and invited the facilitators from Uganda.
Yeah, and
so
actually
it will be a big issue and a learning process for you.
Yeah, actually Richard has just finished his master's as well.
As well,
He is actually now, besides Njuguna, who is one of our seniors who finished MDU, now Richard and Henry Twala from Narok are this year, they are the ones who are graduating next.
Also.
Yes, and then myself and Margaret Ndege.
Wow, that is very good.
Yeah.
So now that you are studying in April,
yes,
what are the opportunities there for Kenyans, particularly Kenyan radiographers? What opportunities do you find are available in Uganda, which they need to take advantage of, especially young radiographers who want to pursue their further education in imaging and radiology? Okay,
so at Cook University, we have from bachelor's, even all the way from the diploma, we have ODU, we have bachelor's program in ultrasound, we have bachelor's degree, that is ordinary diploma, is the most basic. Then we have the bachelor's in diagnostic ultrasound, we have master's in diagnostic ultrasound, we also have bachelor's in medical imaging, and also master's in medical imaging, where some of our Kenyans have already actually trained from there. And it's a very, an eye-opener, because I would say I have been practicing for 10 years. I've been doing ultrasound for 10 years.
Yes.
But when I arrived there, and the things that different. We do, you are humbled.
You found out that whatever you've been doing here is quite simple.
It is actually, I don't know what to call it.
Yes.
I don't want to say the name that one of my colleagues call it. He says we were doing witchcraft. But then, I would say we had to unlearn what the wrong things we had learned. We had to relearn, and now we are in the process of learning.
Sorry to interrupt you.
Yeah.
What is this that they are doing differently there?
Yeah, that
which
we
you
don't.
think in the Kenyan context
We don't.
we are not doing?
The first thing is we don't have any standard protocols. And that is why most of the Ugandan sonographers are actually getting jobs in the UK and outside there because they are following a protocol, a standard protocol. And they also do evidence-based medicine. Like, for example, when you're scanning, let's say in MSK, the shoulder, you cannot just start scanning ad hoc, like you start anywhere. I would give you an example. Last semester, I actually had to redo MSK during the exam. I was asked to redo. I didn't do very well, and not because I didn't know what to do, but because I skipped a protocol. So I was asked to go back for a month and come back and redo. That is how thorough they were. And maybe just to give you a real-time example in that, is that shoulder, the exam that I failed was the shoulder. And in the protocol, you actually start with the long head of the biceps tendon, then you go to the subscapularis, and then you go to the AC joint, that is the acromioclavicular joint. And then the supraspinators, the infraspinators, the teres minor. So for me, I skipped the AC joint, and that is how I was told, no, we follow protocol. Yes. So I had to go back and redo and demonstrate that you actually understand.
So in your view,
yes,
protocols is entrenched
yes,
in the
practice
yes, in Uganda,
yes,
than it is in Kenya.
Yes, that is
so
the
what
first
can
thing
we do in the Kenyan context?
We need to review.
The stakeholders are listening to you.
We need
what
to review
should
the
we
curriculum.
do so that we can also up our standards in terms of practice?
So, because I was trained here in Kenya, I would say probably where we are lagging behind is actually our curriculum is not, it doesn't emphasize on the protocols. Yeah, so we need to incorporate that when we will be doing our next curriculum review. That is one of the things that needs to be incorporated, so that immediately those who are coming in, they are able now to get, you know, the right protocol and the procedures of what we are supposed to do, and they can compete outside there. For those of us who've been trained earlier on, we can actually do retooling, we do CMEs and all that, so that we are able to teach what we have learned. And that is what we need to do. The second thing about what we are not doing right here in Kenya that is done in Uganda is anatomy. We have...
They do a lot of anatomy?
Yes, like in
intensive?
Very intensive, and I would give you the actual picture. In Ernest Cook, we have 2 skills lab. One skills lab has 9 equipments, the other one has 6 equipments. That is for students to practice and learn, not with the real patients, because we have other equipments at the department for the real patients, which are about 11. So in total, we have about 30-something equipments, which is at your disposal to learn. Now, back to anatomy. Anatomy, we have an anatomy lab where there is an anatomist who is a resident anatomist. Anytime you walk in there and you ask him, Mr. Kukiriza, I don't understand the shoulder very well, I would like you to show me. He gets a model.
Take you through.
Remove each of them. The deltoid will show you this is the subscapularis and all that. Beyond that, we have a virtual table, an anatomy virtual table, where you just click if it is let's say the circle of Willis. You want to understand how the circle of Willis looks like. You click on the head, you get the circle of Willis, and you're able to learn. And now the most, and one that really, you know, caught me off guard is that we also learn with cadavers. So we have, in the anatomy lab, we also have cadavers. For 1 year, 1.5 years, we have a male and a female cadaver, so that you're able to understand the anatomy first. By the time you go and scan, you have a picture of what to expect. Even if we have like normal variants, it will not be very far from the normal things that you learned. Could be even that cadaver had a variant itself, you get. But now the anatomist will be there, and our clinical instructor, Mutesasira, is there while we are being taught. And I mean, that is beyond, that is what we should adopt. Because for me, KMTC can afford that, JQuat can afford that. That is an investment that needs to be done.
So there is something we need to learn
yes.
as Kenyans in terms of how we
Training.
want to train
Yes.
our students
Yes,
to be
Yeah.
competent.
exactly.
So maybe someone listening to you is wondering, what is the cost? Can you be able to mention roughly the tuition fee in the cost? Because this could be one of the key challenges to
Yeah, the
young
barriers.
radiographers
Yeah.
who want to achieve this
Want to
kind
go
of
to
feat
school. Yeah.
and this kind of knowledge. They are passionate, they want it, but they wonder what would be the cost implications.
Okay, so for the MDU, which is a Master's in Diagnostic Ultrasound, it is $45.28 per year. When I convert it to Kenyan shillings, when I was paying at that time, because it depends on the exchange
The whole
rate.
course, the whole course is 45.
No, per year.
Oh, per
45.28 per year, which translates to 585,000. That is what I paid.
Okay.
So the entire cost then would mean it comes to about 1090, and that is the tuition fee.
Okay.
Of course, there is a living cost where you're going to eat and sleep. Like for me, where I was living, which is the most basic, was 12,000. Accommodation around Mengo is a bit expensive. And then, of course, your food, it depends on how luxurious or minimalist you are. That's your own cost. But generally, food in Uganda is cheap. And then, of course, the bus, because most of the time, yeah, I couldn't sustain using air transport because it is very expensive. One way is 40,000, but the bus is 4,000 on average, between 3,000 to 4,000 for the bus from Nairobi to Uganda, so that somebody can do a rough estimate of their cost. Yeah, and then for NMI, it's slightly higher.
And you are saying the cost is worth it.
Yes, actually, for me,
the cost is worth it.
By the time I was done with the first year, or even second semester actually, I actually felt that the cost should have been double.
Oh.
Yes, it is worth your money. It is beyond your wildest imagination. I got value for money and much more. Yeah.
Fine. Very interesting to hear.
Yeah.
And I think most young radiographers can take advantage of this. And if you want to reach Madam Nelly Ronoh for any clarification, I think you can text on our WhatsApp number on your screen. Then she will be proud to give you a feedback or further clarification on the same if you want to seek further education.
Yeah.
So let us change our discussion a bit, and now let us talk about entrepreneurship. I understand you are a serial entrepreneur. When I was looking at your profile, I saw you have so many other things you do other than being passionate in ultrasound and pursuing your education. How do you multitask? And what are these things you are doing?
Yeah. So in terms of entrepreneurship, first of all, I would say my first clinic that I attempted to set up was in 2010, and I was in second year doing neurophysiology. I had set up a center in Kisumu called Kisumu Neurophysiology Center, and actually employed one of my seniors who had already finished school.
Was your first staff?
Yes, that was my first staff, and of course life happens, and the department did not pick up. And later on again, when I came to MIS, if you remember during the RASCOM in Kisumu,
yes,
yeah, I actually presented about some of the barriers that we encounter is
capital.
Yes, because I had set up a clinic in Bomet, an X-ray center, and of course, as life challenges would have it, I got an equipment from Biomed who was not very honest, and ended up, taking my money and eventually taking the machine. So I actually lost it completely. And I never gave up. I just said I would keep trying, and one day it will work. And at the moment, I'm actually the founder of ACE Imaging Center and upcoming ACE Academy. And my center is located at 40 Suites in Upper Hill, just next to Kenyatta, at 8th floor, suite 802. And I will be opening doors for work on 16th March, which is Monday next week. Everything is set up. And that has been my journey. At least finally we are there.
Let us talk about failure.
Yes.
In entrepreneurship.
It's part of growth.
You put an investment,
you lose
the car. maybe due to other external
Factors.
factors which were beyond your control.
Yeah.
So, do you regret?
No. Actually, for me, those are now the ropes. Yeah, the learning ropes. You know, actually, failing is part of growth. Even a small child, when they are learning to walk for the first time, they wake up, fall, and eventually they walk upright. And that is what I would say is the same thing in entrepreneurship. When you start and it fails, don't give up, because if that is what you would want to do, and in most cases, when you're going into entrepreneurship, it's because you want to create an impact. Just like what you're doing with us today.
Yes, yes.
This is impact that you're creating. You're able to reach more people. Were it not for Medicwise TV, which is your, brainchild,
Yes.
then we wouldn't be here. Yeah. And that is what I would say about that.
So you have no regrets,
No.
absolutely,
Not at
of
all.
having a fail.
No.
So
And even losing
failure,
money.
you agree that failure is part of the game,
Yes, it is part of the growth.
and it's
You
the
actually
highway
can't
to
grow.
success.
It is.
One
It is.
day,
It is.
and you still soldier on.
Yeah.
Tell us about your new venture. What are you putting up, and what are the prospects?
Okay. So one of the things that I would say is that my center is majorly an ultrasound center, because for me, I believe in mastery. I believe in doing what you understand and what you can do best. I don't believe in being everywhere, and you're not, when you're a jack of all trades, you become a master of none. So mastery for me is something that I have come to learn over time. I have grown up. I used to be a jack of all trades. I would work everywhere. I think Nairobi, there must be my signature in every computer.
Every imaging department. No,
Yeah.
very
Yes,
and the historical records of them.
yes. Actually, even
I mean,
today,
I've walked around and did
it was
work here,
survival.
2, 3, 1 month.
Yeah, it was survival, and I would say it was necessary. Yeah, but one thing I've come to learn is when you focus on one thing, you become better in it, and you're able to actually reap much more from it than when you're everywhere. And that is why I set up an ultrasound center and a neuro center. So my clinic will be offering EEG, which is electroencephalography, and nerve conduction studies, and later on we will introduce sleep studies. And then it's
Studies.
yes. Yeah, that is a long recording. It is like an EEG it's an overnight, recording. Like you see the way Holter is done for the cardiac.
Yes.
The way it is it's a long recording. There is 12 hours, 24 hours, so that you're able to pick some of those signals. Maybe some of them come while someone is asleep, and therefore you're able to pick. So that is the neuro bit, which we will discuss that in detail in a different forum. But then the reason I put that as one of my services is because around Upper Hill we have scarcity. And at the end of the day, I keep saying the most important people that we are serving is our patients. So if I can be able to assist and help in one way or another to be able to give access, then so be it. But then in terms of ultrasound, I'll be doing, apart from the basic scans that we do, which we know, I'll be doing highly specialized exams. Like for example, I would give you like venous insufficiency, for example. In Kenya, the kind of what we do as venous insufficiency is not correct. It is a long scan. You have to assess each and every, vessel. Actually, one leg takes about 1 hour. So bilateral venous Doppler for insufficiency would take you between 1.5 hours to 2 hours. So you can imagine what we do is because we do not know the correct protocol of what is supposed to be done. And remember, that is what guides the surgeon. If that patient is supposed to go for ablation or not, then you see the way we have patients who have swollen feet most of the time, we just write them as lymphedema and all that, yet it is insufficiency. And you need to grade that reflux and tell them if it is mild, moderate, or severe, so that they decide which one to start with and be able to help that patient. So that is one of the highly specialized exams I'll be doing. I'll also be doing a dedicated endometriosis protocol. I'll be doing eye ultrasound. I know most of us probably do not
I've
know that
never
we
touched
have.
the eye. I've never
Yeah.
touched the eye to
Yeah,
scan.
yeah, it is called ocular ultrasound, whereby you check the optic nerve, you check the vitreous chamber, you want to check the retina, if there is retinal detachment, you want to check the anterior chamber, the posterior chamber, those things. Yeah.
You must be planning to charge a lot of money for this.
It's average. I'm actually charging market rate, and my benchmark
For
was
example, ocular, how much are you intending to charge?
9,000.
9,000.
Yes.
So like a simple CT scan.
Yes, and
So you are not very expensive.
no,
so to
but
say.
for venous insufficiency, I have actually looked around, and the market rate, they are charging 9,000, which is not viable. So for me,
So you want
for venous, bilateral venous Doppler,
you charge more
I will actually be charging 19,000.
value for the education you have.
And even the patient will actually see that they have value for their money, for sure. Because like one leg, the kind of argumentation that you do in one leg is about 50. And you need somebody to help you argument. You need somebody to be filling the form.
Maybe
Yeah.
just being curious. Does doing these highly specialized exams require a highly sophisticated ultrasound machine?
No.
All the ordinary machines can do them.
It's the ordinary machine.
So what you need is just the knowledge,
It's the skill.
the skills of doing it.
Yes, it's actually
Okay.
the skill, because one of the things in radiology that is completely underutilized
Yes.
is ultrasound. And I'll give you a good example. Or even, let me give you an example of the shoulder, for example. If somebody has impingement of the supraspinators, for example, it goes
What
into
is
the acromion.
impingement? You know, I'm a medic, but you are
Kufinywa,
taking me higher.
kufinywa, you know, like compression, you know, because the
Are you talking about subluxation?
No, that is not. It's impingement. It has been
Impingement, okay.
compressed. Yeah.
Fine.
Yes, because the supraspinators goes into the acromion and back. Even if you did an MRI, you will not be able to see that, because it's a
But
dynamic.
ultrasound?
Yes, because it's a dynamic examination. You do it when the patient is abducting, and you see it going in and coming back, or it's trapped and it's bulging. Then you'll be able to say that that is the pathology. So, I mean, ultrasound is completely underutilized.
Oh my
Yeah,
God.
there are so many MRIs that are done which are unwarranted.
I didn't know.
Yes.
Oh my God. But
Yeah.
this is good. You are bringing forth
Yeah.
new knowledge,
Yeah.
and you are pushing it harder to go beyond,
Yeah.
you know, beyond expectations,
Yeah.
extra mile in trying to rediscover what ultrasound can do
It is a
and
lot.
bring the services available and closer to the people.
It is true, and even
So we want to wish you all the best
Thank
in
you.
your new venture,
yeah,
and we will be there to support you
yeah.
and to cheer you along as fellow professionals
Thank you.
in the same field.
Thank you.
Maybe you have something to tell us about
The academy.
the OPOCAS first.
Oh, okay.
Because
OPOCAS.
OPOCAS has become the word in
Very
the
popular.
streets
Yeah.
recently.
And most of our sonographers feel that
Feel it is threatening
we are
their
betraying them.
jobs. And the young radiographers especially feel that training
Yeah.
doctors, training clinic officers and nurses on OPOCAS
Yeah.
is simply taking away their jobs,
Yeah.
and they see anyone advancing that kind of training as their enemy.
Yeah. And
Have you interacted with the OPOCAS?
yes, actually, I'm one of the trainers who train OPOCAS in this country.
So you are the enemy of radiographers.
Actually, people
So
feel
to
that
say.
you're the betrayer. You see? They
You are
see it as
betraying
betrayal.
radiographers.
Yeah,
You should be hanged.
I know.
Yeah.
So, POCAS, maybe just to say, is that right now what has been rolled out by the government is OPOCAS. That is
OPOCAS.
obstetric POCAS.
Yes.
And POCAS is point of care ultrasound, yeah, in full. But then POCAS has many aspects. There is for emergency, there is FASH, which you do for HIV, there is POCAS for peripheral nerves, for nerve blocks, there is POCAS for lung, there is POCAS for TB, and all those things. So it's a whole, it's a dynamic, you know, POCAS is here.
And
with us.
what do we have in Kenya now?
Or
Which
POCAS. Or POCAS, obstetric
OPOCAS.
POCAS,
So means
which has been rolled out by the
only for
government.
obstetrics.
But that is what has been, there is a structure for it.
Okay.
But it doesn't mean the rest are not being trained.
They may come in later.
Yeah, so back to POCAS itself, I've been privileged to be part of the sonographers who developed one of the, I would say, POCAS curriculum, which is the Amref University curriculum. And I would tell you that in the Western world, POCAS is a stethoscope. You see the way we use stethoscope to check the patient?
That is in Europe.
Yes, yes. What does that tell you? In Africa, we are lagging behind. People don't use fetoscope anymore. The midwife, their work is to take that POCAS equipment, the handheld equipment, they check if they are suspecting there is no fetal, cardiac activity, they put it there, they see, oh, it's still there. They measure and they just, make a decision from there. So POCAS, in essence, is supposed to help to save the patient. And I'll give you a good example. In a level 2 hospital, back in my village is Kapkures village in Bomet,
yes,
whereby we have a health center, which is a level 2 health center. That health center, they do deliveries from that center. There is another center next to my home called Kiptulwa Health Center, which is one of the biggest health centers around, and they still deliver. The question is, I have, a few years ago, I used to do SRC, like just once a month I would lease an equipment and I go and do ultrasound for women freely because they are the people who took care of me. They are the people who made me who I am. That is back to my community. And at one point, I would give you an example. I got a mother who came na boda boda, and her cervix was open. I told her she cannot go back home and she cannot use a boda boda. She has to go to Kapkatet. I didn't have even a referral form, but I just wrote on a paper and wrote my findings. And during my graduation in 2020, she came home. She was part of the people who insisted that she wanted to speak. And she actually said that I saved her life because that day she got to Kapkatet, the cervix was, she said actually when she arrived, the water broke and she had a baby and that baby went to NICU for 2 months. So what if she had not come for that scan? Those are some of the things that we need to think about. We are not thinking, jobs for us are there. It only depends on how serious you are with your work. If you're good, you will never miss a job. If you're average, then you will remain average and you will remain at home. You see? So the jobs opportunities are there, and not only like working in a hospital. The reason why we went to school is that you should also be innovative. Yes. You should think about other avenues of how you can be employed. So, in other words, I'm just trying to tell you that POCAS is supposed to help that mother who is helpless at home. Another one told me that she was going to deliver at home because I asked her, how are you going, this is your what pregnancy? She told me it was her 7th baby. And I told her, do you plan to go to the hospital to go and, deliver? And she said, no, I've delivered. And she had placenta previa. What would have happened to that mother? So POCAS is here to help in, reducing fetal-maternal mortality, which is a big burden, yeah? And therefore, we should embrace POCAS. And secondly, it should be us who should be training. When we are busy complaining and saying people have taken our jobs, where are we when we are fighting? And this is a ship that already left. It is the government. We cannot stop it. The only thing is we can be in there to be able to regulate. And I'll give you like an analogy. In ultrasound, when we were being taught obstetric ultrasound for my master's program,
yes,
the protocol, I'll keep referring to protocols. Yeah? Yes. The protocol is the first thing that we do is what is known as fetal survey. And that fetal survey is actually now what is POCAS.
POCAS.
And it ends there.
The initial basic survey.
Yes.
Before you do further study.
Before you now start doing other things, that is what you should do. It is fetal survey. And if you ask me what is fetal survey, it is just ensuring that one, you're answering the location. And when you're answering the location, you need to put your probe sagittal, you need to see the cervix, you need to see the fetal parts, you need to see the anterior myometrium, the posterior myometrium, and you need to see the bladder anterior to the uterus. That will answer question number 1, location.
So in a nutshell, you are saying,
yes,
POCAS is not taking no one's job.
No. If anything, it will add on to your job because the curriculum, because at least I'm privy to have been, I'm privileged to have been part of those who developed those POCAS curriculum,
yes,
is that anytime the midwife or the clinical officer or whoever is, doing that POCAS, find something that they are not sure, the first thing is refer for a comprehensive scan. Yeah. If it is a mother who is at term in active labor and you put your probe there and you find that the head is not facing down, the next thing is you get an ambulance. That person should go to a level 4 where there is a surgeon and they'll be able to be assisted.
Now a scenario comes into play whereby you find that these who have tentatively or ostensibly been trained for POCUS, they have port machines, they have mounted ultrasound rooms, and they are scanning, and they are writing funny reports, and they are being circulated here in social media. So what is that gap? If all POCUS is here to help the community, to help the
patient
practice, don't you see a gap there?
So for me, I would just say that those who are doing that, it's a matter of time, because with our radiographers board, which is it is just about to go, to be effected. Actually, all those centers will be closed, because they are not sonographers. You stick to your POCUS, and even when you're writing report, it is on that ANC book. It is not a full report. It is just the ANC book that you note that all POCUS was done and these were your findings, including if this patient needs to go for further management. That is where they indicate and say for comprehensive scan. But when they are coming for this comprehensive scan, what is it that you saw which you need an extra eye to be able to see? Was it placenta previa? And that is, so for those who bought those machines, and it is just a matter of time, probably less than a year, all those places will be closed. We shouldn't be worried about them. Those are noisemakers.
So people should not be worried.
Yes.
You told me you are a feminist.
Not a feminist.
Are you a feminist or an activist? What are you? you are a chauvinist.
I'm not.
You champion women rights.
Well, for me,
this is one of your clowns. People need to know.
I am not a feminist per se. What I would say is I promote women, and I love talking about women because the kind of challenges that I've had to go through as a woman, has been enormous.
Bring it on.
Yes. And first of all, being a teenage mother, maybe for those who don't know, was not an easy walk in the park. People would have expected that you lose focus along the way. The thing is, it took a longer journey to get where we are today, but ultimately we got there. And that is why for me, I'm very, women go through different challenges that people hardly talk about. People assume that women are stronger than, anybody else, and they need to be resilient, they need to be this and this. But what actually women need is a platform to be empowered. Because yes, we are the pillars of the community. When you empower a woman, they say you empower an entire village. And that is actually true. Because today, people in my village look up to me. But in terms of that girl child who feels that, getting pregnant when you're a teenager or when you're not done with school is end of you. It is not. It is just a detour. And what happens is, for me, I got a lot of support from my family, and I was able to, come back and be able to come back to school and to soldier on. And that is why I said one of the things that I will be doing, probably once I stabilize, is I will actually have a scholarship for young women who want to pursue imaging. And that will be part of my giving back to the community.
And that is part of being a feminist activist.
Pro-women.
So, that is the future of
I have had to go through a lot of challenges. If I didn't have support.
So you have passion to transmute support to
to ensure that they don't drop along the
girls
way.
Who may be having or going through your
challenges. Yes, actually it's very little help. It's very little help that they need. One is probably to just give them an opportunity to be able to go to school, and you support them while they're in school. After that, they're able to take care of themselves and they don't become like victims. That victim mentality. That is what needs to be removed, because once you empower somebody, they're able to stand on their own, and therefore they just live a normal life. And as I said, women, especially with the burden of, children and all that, sometimes it can be tough. And, when you don't help this woman, they are not able to help their children. And therefore, it's a vicious circle. Yeah? If it was poverty, you continue with the poverty cycle. Yeah? So for me, I would actually say it has been a long journey, but it is doable. And all we need to do is to help and to support those who are in those, challenges. Like, for example, I would give you a good example. In 2022, I went into depression, mental health issues, and I left work and went home and stayed at home for 1.5 years. But the only reason why I came back is because there were people who supported me. Yeah? And that is what I'm talking about. It is not a straight line. But what is your focus? Where do you want to end up? You should never lose focus on the goal. And that is what I would say.
That's big bro, whatever, family. Brings me back to, I've experienced you, and I think most of the radiographers have experienced that when we have welfare issues, you are in the front line. Especially when our members are bereaved, and you help us come together
to mobilize
resource, and raise funds to support welfare. Maybe you could be speaking from your own experience today to the members. What is your experience on this? And what do you think we need to do as members of the Society of Radiography to bridge the gaps on welfare and support during hard times?
Yeah.
And you should, this is the time you can share your experience with the members.
Okay, so one of the things I would say, how I got into that, is that I was serving as a committee member in the Benevolent Committee for SOC. And I was the secretary. So that is how I got into, being able to help and assist in welfare. But then after I left the committee, I think people had already associated me with the mobilization and all that. And I found it as a positive thing to be able to help other people. Because I'm in all the groups, all the society groups. And it becomes easy for me to be able to reach each and every one of us, including those who are not members of SOC. So in my own experience, one thing I would say is that radiographers, we love each other. That is the truth. I have had first-hand experience when I lost my brother. I was given a lot of support. I've had challenges when I was struggling. I was still given support by radiographers. And up to date, I've always seen people being assisted, even yourself, you've been assisted. There are so many other, radiographers who have been assisted. And I would say we love each other. That is the baseline. So small things should not be breaking us. Yeah. Baseline is that we love each other and we are able to support one another. Now moving forward, because sometimes it becomes overbearing, it becomes, people have different challenges. They may be having their own struggles which they are not talking about, and they may not be able to support. One of the things that we had discussed during the time when I was a member of the society, the committee, we were thinking of an insurance that is, tailor-made for our needs. And I know that is still in progress, and hopefully it will come, into play very soon, so that we are able to get our, members assisted when that time comes. Because one of the things that could happen is if we have an insurance and we know that the money will come from the insurance, then in the meantime, when this person needs that, urgent amount of money, the society can step in and be able to give maybe a percentage of it so that they are able to move on. And then when now the money is remitted, because probably we will have a way of remitting the money through the society, then they can be able to deduct whatever had been given to that member. In that way, then somebody is able to be assisted over time, so that we don't have, this contribution. Like right now, for the last 3 months, I've had 3 contributions, and sometimes it's overbearing for members that, we don't predict death, and it is an emergency. It is never predictable. So in my own opinion, what should be done is we should have a structured way, and I would also encourage our members. I mean, all radiographers should be members of the society. And you know, I keep wondering when people say SOC, you know, when we go to meetings,
this is a perennial problem with young radiographers.
Yes. When we go for meetings,
there's a lot of apathy, becoming members and being part of the Racha group.
Yeah, some of us, because we've been very vocal, they call us SOC. Nyinyi watu wa SOC, you know. And exactly. So, who is SOC? SOC is all of us. Yes, SOC is all of us. SOC is all of us. As long as you're a radiographer, you should be a member of the Society of Radiographers, because when you belong to that society, you belong to a community. You belong to, you know, you're able to even speak. And people should not say that SOC is not working, SOC is not doing this. SOC, they are doing what they know best. So why don't you come in with your new ideas?
But you see these things play out in the public. Like now, there is a lot of discontent about SOC leadership. Very open in the social media. Especially there are issues to the effect that the honorary secretary abandoned this office and someone has been acting in perpetual. And recently you saw in WhatsApp people complaining that the treasury's report has not been released. Do you think this plays well to the members in terms of winning the trust of members of the society?
For me, I would say I wouldn't want to speak on behalf of SOC, because there are people who are mandated to speak on behalf of SOC, but I would speak on my own analogy and my own judgment. Is that number one, as a member, we should not be washing our dirty linen in public. That is where first we fail. Even as members, we fail. Because when you want
to... In the last AGM, actually one council member, and he was here, brought a motion to impeach and remove from office the Secretary General, who ostensibly was claiming he had abandoned this office. What do you see? What's your view on that?
For me, I would say if it was procedural, according to the Constitution, then it is right.
Okay.
Yeah. If it was not, then it is wrong. Because whenever we endeavor to do anything or to move, to remove somebody out of office or anything, there should be a guideline to be able to guide on that. Yeah. So for me, the disgruntlement that is around is, I would say we need to find a way of containing. Another thing is we need to have maybe a different committee that comprises people who have been before us, who are senior, who would, form that committee to discuss such issues and what has been done before. Like our former presidents, for example, we have like Madam Jue, we have Mucheusi, we have the likes of Kinakikwai, we have, our seniors, who have been serving for long, and they have also been managers in their own institutions. These are people who have a wealth of knowledge on how to be able to solve such issues. The biggest thing that I would say is we don't wash our dirty linen in public, because once we wash it as radiographers, even other cadres see it, and it is not a good picture to us. So when we are not members of the society, and during AGM you cannot attend, and you complain out there, and you are not a member of SOC, then you are a stranger, because you are complaining on behalf of who? I thought it's the members who should be complaining, and if these members who are complaining also have a proper channel of channeling things, write it. Like now we are going for the AGM. Did they give as one of the agendas to be discussed? Because you're entitled as a member to give your own views and suggestions. So I think, in my own opinion, SOC has tried, but there is also room for improvement, so that our members can feel that they are part of it. Like now, this time having the AGM in Nakuru is part of the progress. Because initially, for the many years, from when I was an associate member as a student, we have had all our AGMs in Nairobi, which is very limiting. If this time we have it in Nakuru, next time we have it in Eldoret, the other time we have it in Kisumu, then our radiographers will feel that they are part of it. And that is how we are able to have those members on board. Some of the other things that we need to do as a society: how do we celebrate you know, other cadres, I see them celebrating people who have been exceptional, people who have served well, people, even students who are exceptional in their yes, those incentives and all that. Those are some of the things that will be able to bring people on board, because they feel that, you know, their work is noticed and they are part of a family. Yeah. So some of those things probably they should be, you know, a way of just making sure that we have. Though of course I know with the radiographers board, what will happen is that it will actually necessitate that we have you are a member of a society, and somehow all the radiographers will just be forced to be part of it. And I saw today somebody...
Are you raising a warning that they should be prepared that sooner or later?
Yes, it is
even
inevitable.
If they don't want to be members
they
now,
will be part.
Sooner or later they
yes.
will be forced to be members.
They will.
Of SOC,
yes.
Once the act comes into play.
Yes, they will be. Because you cannot, I mean, you cannot be... everybody actually has to be associated to their own body, you know. And one of the things I saw today is that Akodongole has raised a motion on a waiver, yeah, which will be discussed during
AGM.
During the AGM.
Okay.
And one of the things I would say is, for me, in advance, I actually support, so that we have, you know, an earlier, you know, we have more members, especially those who've just graduated and all that, and because it will actually become mandatory.
But many are also of the view that in the just few years, waiver was introduced and it never worked.
Maybe there was no sensitization. Yeah.
Maybe sensitization.
Yes. You should actually introduce a waiver, circulate it, give it enough time, publicize it, make it known to everybody, write to the chief radiographers in all the counties so that they have it in their notice board as a memo, so that everybody is aware. Yeah, because when others were aware and others were not, then how do you quantify that? So let's just say, since it is now here with us, let's give it one more chance. Yeah.
Okay.
But let's publicize it and give it enough time.
Listening to you, Nelly, you have a lot of knowledge, which I believe it should be well utilized, especially if you worked in a training institution. One time you were a lecturer.
At KMCC, yes.
Why did you choose to leave?
One thing I like saying about why I left, it was during that season that I had already talked about in terms of, you know, mental health issues. I think I had been on an overdrive for many years.
Okay.
I was slipping things under the carpet. And you know, one day, if you don't service your car, one day it just stops and it doesn't move. So it was just a season, because I not only left KMTC, I also left Aga Khan and left everywhere else and went home. So for me, I would say that was, I left to save my sanity. Yeah, everything was just overwhelming.
Maybe you, talking that way, listening to you that way, maybe you have some advice to give on mental health issues.
Yeah, mental health issues
because if you were overwhelmed to the extent that you had to stop working everywhere and retreat back home, it has something you have learned about mental health. What can you say about this?
You know, in this era, at this time, we have so many challenges. We have competing needs. We have, you know, expectations for yourself, beginning with, for, you know, the society, the people around you and everything. And sometimes everything just becomes overwhelming. Yeah. Some of us, like for me, who went through divorce, is also not easy, raising children alone and having to deal with such things, and life has to continue somehow. Yeah. So you need to be aware. You need to know when to stop. Like, another issue I have is that I have insufficiency. Yeah. Because of the long working hours, I would work 24 nights in a month, and I'm working during the day.
Yes.
So you can imagine, in 1 month, I'm working equivalent of 2 months. Yeah. And of course, it took a toll on me, not only with my mental health because of lack of sleep, because that is one of the things, but also physically. Yeah. I've actually improved right now in terms of the insufficiency that I have. So we should have, like, one of the things I would propose when we have our radiographers board in action, part of the budget, we should have a mental health specialist who our members can go to anytime and they're able to talk their issues and, you know, alleviate and relieve them so that the pressure, ni kama balloon imeshajaa hivi, at least hata apunguze kidogo, you see? So for me, I think we lack a lot and also awareness in terms, I'm happy that nowadays there is a lot of awareness in mental health issues, there is a lot of support, even with employers, but even us as a society now, we need to make sure that we also take care of our staff, because if our staff is not well, they cannot perform even at work, they cannot perform at home, they cannot be a better brother, they cannot be a good sister, they cannot be a good colleague, and those are the things. And yet we want to make sure that we bring out the best out of ourselves. So for me, mental health, you should purpose as a person. Before that comes, purpose as a person. Like every 3 months or every twice a year, just go for a debrief. Just find somewhere to go and talk about your issues in a safe space, probably with a psychologist or something. Tell them about, it's just 5,000 shillings. How much have you been working for the entire year? And it actually helps because somebody else is looking at it without any bias. You know, if today I came to you as a radiographer, you have bias about radiography, but a psychologist out there is looking at it from a neutral point.
Different.
Yes, and can pick, and can easily pick where the problem is. Is the problem you? Is it coping mechanism? Is it the work environment? What is it? Yeah. So for me, mental health should be 1, personal initiative. Number 2, you should know, you know, they say a good dancer knows when to stop. You should know when to stop, when to take rest. Yeah. And that was my biggest undoing. I was on overdrive for over 10 years. And one day, I like saying it as a story when I tell my, you know, the young girls that I mentor. I tell them that, you know, it's like a car that I drove and drove, never took it for service. And then one day it ended up in a forest. Na ikakataa kuamka na ikakataa you know, to move. That is what happened. But why I would tell you, that is also how I found my passion. Because when I was at home for those 1.5 years, I would wake up, because I took my kids to boarding school at that time. I was not mentally, you know, well to even take care of my kids. I had anger issues and all that. So I said my children should not be part of my chaos. Yeah. So I took them to boarding school, and I used to stay alone with my dog and my shamba boy at home. And I used to wake up every day and ask myself, like after 1 year, that is, I used to ask myself, do I miss that probe? If my heart that says no, I continue staying. And one day I woke up and I told myself, do I miss the probe? You know? And I was like, yes. And I woke up that day. Yes, the day I arrived in Nairobi, I actually called my mother and told her to give me transport to Nairobi. My sister at that time was doing her degree at JKUAT, so I knew at least I have accommodation. And I went to Mpisha, talked to Dr. Tuku, and I told him, you know, life happened and I'm back now, I'm ready to work. And he actually wrote a letter, an email to the HR while I was seated there. And that is how I came back, and that's how I was able to work. Yeah.
Wow. Now, maybe we should not close this interview before you air your views on the upcoming LASCO conference. It is happening in September.
In Kisumu.
In Kisumu City.
Yes.
What can you say, maybe for purposes of time, maybe you have something to say about it?
I'm really looking forward to LASCO. I think ever since I was a student in radiography, that is MIS, I've only missed one LASCO. And I would say, and that was the last LASCO that was in Diani, I would say I'm really looking forward to it, because LASCO is where we get to, you know, interact, we get to see what the world out there is doing because of our international delegates. We also get to learn each other's personality, capabilities through the presentations that are presented. And also most importantly is that this year LASCO is something that, you know, is very dear to me, because one of the things I'll be doing is from the training that I've gotten in Uganda, and I've been talking about protocols. I'm actually doing a handbook on ultrasound protocols for every examination. Yeah, and I will be doing it, I will have those handbooks available for those who would want during LASCO. And also, the other thing I'll be doing during LASCO is I'll be doing a presentation on report writing. Some of the things that we've forgotten is how do we write our reports. Once you see the pathology, are you able to communicate it properly? Yeah? So that is why I'm really looking forward to it, because I'll be bringing in some of the, the knowledge that I've been able to acquire in my master's program, yes, and be able to disseminate to other people. Yeah.
Wow, that has been a discussion, really very hot discussion. I think it cannot end. When you are speaking to Nelly Ronoh, you can speak, speak and speak and speak. And we wish to end it there, but before we end it there, sorry, I'm
Nelly.
pronouncing your
Yes,
name.
it's okay.
A big issue to me,
Yeah.
but I'm sorry for that. What is your parting shot to medical professionals in this country,
Yeah.
and more particularly the radiographers in this country? What is the parting message do you have for them?
Okay. So for radiographers, I would like to say that we have a lot of opportunities. We not only, have we have research that we could do. There is actually no research radiographer who does purely research. Yet there is a lot of funding. Actually, some of the things that that is also underutilized is the resources from NACOSTI, where there is a lot of money for research. So we should embrace research. That is one. Number two is that one thing I would say is that Africa does not lack intelligence. What we lack is systems. And it is our time. There is no future. We don't say there is a future. What is the future? The future is now. What is it that you can do? What are some of the innovations that you can do? And something else that I would say is for my PhD, I would like to actually develop a prototype, an ultrasound equipment that will be developed here in Kenya. And of course, I will need a team of sonographers. Yes. So for radiographers and those who are aspiring to be sonographers like myself, there are no shortcuts. You need to work hard. You need to upskill. You need to retool. And retooling is relearning and unlearning and learning and never stopping to learn. So I look forward to meeting you during the AGM on Friday and Saturday as we learn the wrist. I will actually be doing the wrist on Friday. So thank you so much, and thank you for this session.
Yeah, much appreciative, Madam. We don't take your presence here for granted. As Medicwise TV, we wish to appreciate and thank you so much for attending and being present here and giving your insight on professional matters to do with imaging and radiology generally. I think you have been a blessing to us, and for gender purposes, this we have been having guests here, and we have not got a person of your gender. And this is a double benefit because you already also are a feminine chauvinist. So we appreciate that so much for being here.
Yeah.
And I was your host, Didakus Mochache, aka Dida the X-Ray Man. And we wish to thank you for being here in Medicwise TV. Remember, Medicwise TV is sponsored by RadMed Connect, supplier of medical equipment, be particular X-rays and ultrasound machines, radiology supplies generally. So please, if you have contacts out there who need these services, don't fail to contact us. Our numbers are on your screen. And for Madam Lenny, what a wonderful evening.
Thank you.
What a wonderful show.
Thank you.
Thank you so much for coming here.
Asante.
Be blessed.
Asante.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations. Globe Care Hospital in Eastleigh, we delivered and installed an X-ray machine. Lydia Key Memorial Hospital, we delivered and installed an X-ray machine and a computed radiography machine. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Centre. Jabs Medical Centre. Why should you choose RadNet? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalised support for every client. Thirdly, we have a proven track record in successful installations.